Dear friends, I hope all of you are well. Today, for next 25 to 30 minutes, I would be discussing basics related to epidemiology. If you have query at around 12:50 or so, you can ask. Up to 12:30 for next 25 minutes, I would be discussing. The topic allotted to me is principles and concepts in epidemiology. All of you know well since long the clinical medicine. You have heard of the term gynecologist, ophthalmologist. You may not be knowing what is epidemiologist, but probably all over the world, the COVID situation, the most unfortunate event of COVID pandemic, showed that an epidemiologist is also an important person, very important person, and epidemiology is also very important science. Still, many people ask us that what do you teach or what do you do in epidemiology? The other name for epidemiology is public health. The NMC, National Medical Commission, has identified our subject as community medicine. So, what we do in community medicine? I hope all of you currently must be aware that a number of activities are going on all over the country, probably all over the world, related to community medicine in context of the most unfortunate event, pandemic of corona. Basically, there are three things which we should remember as far as community medicine is concerned. You may call it as basic understanding of epidemiology or principles of epidemiology. The first important thing is, what do we do or what do we mean by epidemiology? It is the science of frequency and distribution of diseases. We would like to know what number of cases of COVID-19 new cases are taking place in our country. That is frequency of diseases. It is not only COVID-19. We are all interested in the frequency of malaria in our country, frequency of dengue hemorrhagic fever in our country, deaths due to leptospirosis. Whenever there is season of leptospirosis, usually starts from June, July and continue up to November, December. Similarly, we all are concerned about the maternal deaths, a lady dying either due to pregnancy or complications of pregnancy. Similarly, the central government as well as the state government is very much keen to know the frequency of road traffic accidents, the frequency of patients getting injured because of the road traffic accidents, the fatalities due to road traffic accidents. The society is also interested in knowing what proportion of young adults or productive age group are committing suicides. Similarly, the Department of Psychiatry is also interested in knowing the rate of attempted suicide. The crime department is interested in knowing what is the frequency of homicides. What are the frequencies related to accidents other than road traffic accidents. So all these frequencies are being collected, compiled, analyzed and monitored not only by health department but other departments are also involved in it. So basically frequency of diseases is an important indicator about the status of health. The epidemiology takes care of collecting the data related to frequency. A variety of indicators have also been identified how we would measure the frequency. Is it only the count, that is numbers, which matters, or some other things like rate? All of we know three important things in epidemiology as far as measurements are concerned: rate, ratio and proportion. The detail would be discussed in tutorial also. We are interested in knowing currently a specialized kind of rate, what we call attack rate. What is the attack rate of COVID-19 in India? We might be interested in knowing what is the attack rate in Gujarat, what is attack rate in Maharashtra, what is attack rate in Bangalore city, what is attack rate among 60 plus age group, what is attack rate among those who are older than 45 years of age and having some comorbid condition. All these things are very much required for better planning, for preventing transmission, for reducing deaths due to COVID-19. I hope all of you know that this is not restricted to COVID-19. The same frequencies and distribution can be calculated and are being calculated regularly for, say, a number of infectious diseases: malaria, dengue and dengue hemorrhagic fever, measles, chikungunya. Not only infectious diseases, a variety of non-communicable conditions, say for example hypertension, ischemic heart diseases, kidney diseases, a variety of cancers. We are interested in frequency. What is the magnitude of the problem? Should we give priority to a condition? Say some conditions are there. For example, yos. Yos is a condition similar to a venereal disease like syphilis. But the magnitude of problem is such a low that it can never be a priority for our country. Some of the conditions like Crimean Congo hemorrhagic fever, its routine occurrence is unusual or say rare. So the state government or the central government or any health authority for that matter, including local health authority like Ahmedabad Municipal Corporation, Chennai Municipal Corporation, Surat Mahanagar Palika, everybody is interested in knowing frequency in form of various indicators. As I mentioned, attack rate is an important indicator which gives us an idea that how fast the disease frequency is increasing, how fast COVID is spreading, how fast COVID is spreading in rural area, how far COVID is victimizing young individuals. Similarly, second thing comes after frequency is the distribution. Let us take an example of COVID-19 again, how it is distributed. We may start our discussion that what was the epicenter, from where it was started, how it spreaded, what were the modes of transmission, and currently what is the distribution. Distribution in terms of geographical area. Is it more in urban area and very few cases are there in rural area? Is it so that the COVID-19 is affecting senior citizens more than the young individuals? Is it so that the patients having hypertension, diabetes or some other chronic diseases are more likely to get COVID infection, more likely to get complications because of the COVID-19, and they are more prone for mortality? So this is what we call distribution. Similarly, we know that a particular disease has got seasonal distribution. Usually arthropod-borne diseases like malaria, chikungunya, dengue, some other conditions like leptospirosis, these are more commonly seen during rainy season. Some viral infections, say measles, this is currently the spring, January, February, March, April, these are the right time for viral infections including measles. So distribution can be studied in terms of geographical area, in terms of seasonality, in terms of at-risk population. Now third comes the determinants of the disease. Which factors are responsible for occurrence of diseases? These we learn in epidemiology. These are the basic concepts. Which factors makes a person more susceptible? Which factors are involved in transmission of diseases? All these things we learn in or we understand in epidemiology. Coming to the epidemiological traid, probably one lecture is already over for your batch. I took that session on epidemiological traid. It is a triangle. One corner or one angle is agent factor, one is host factor, one is environmental factor. By this time, all of you are aware that most of the disease occurs because of the combination of different agent factor, host factor and environmental factor. In absence of any of these, say for example in India, certain viruses are not available. Viruses are agent factor for some of the conditions. If that is not available, even though the transmission channels are open, the vectors which can transmit the disease is there, but that disease would not happen. One of the well-known viral infection, yellow fever, is a condition in which that agent factor is missing in our country. Although a number of environmental favorable conditions exist, susceptible host exist, but the virus of yellow fever is not there. Still, we could have, or we are successful in preventing the entry of yellow fever virus from most of the African countries to our country with variety of public health measures. So second important concept in epidemiology, which we have already discussed previously, is agent, host and environment factor. Their interaction leads to the disease, and then that disease we would be calculating what I have already told, the frequency. We have variety of indicators. We would be just remembering the incidence and the prevalence. The incidence usually talks about the new cases. Currently, all of we are reading in the newspaper how many new cases are adding day by day. If I talk of distribution, we may have tables available that are these new cases coming from urban area, or are these new cases are clusterized or concentrated in old age group. Coming again more, say after some months, we might be concluding that most of the new cases occur among senior citizens who have not taken even a single dose of vaccine. So this is the distribution. Urban, rural, age group, gender-wise distribution, caste community, geographical area. In a variety of way, we can have frequency against distribution. I just mentioned that we may be able to tell that the attack rate was very low in a decimal of COVID-19 among those who are already vaccinated with 2 doses as compared to high attack rate among those who are not vaccinated. All these information would be very useful in either establishing a strategy for control or ongoing changes which we would like to have in our policies, in our actions. So frequency and distribution is very important. I would like to add that this is not just related to health or health related conditions. Nowadays, to show our preparedness, to have our preparedness, we are counting what proportion of beds are available for severe cases of COVID-19 who are likely to occur in future, who are likely to get admitted in public sector hospital or private hospital. We might also be interested in knowing what is the average length of stay of a COVID-19 patient in hospital. All these things are very important as managerial tool. So calculating frequency of cases vis-a-vis, we must know whether the adequate number of beds are available, adequate number of other facilities like ventilators are also available or not. All these things, all this counting are required. So I mentioned two important concepts: frequency distribution and determinants. Some aspects in determinants. Most of the conditions are multifactorial. In infectious disease, combination of agent, host and environmental factors. Similarly, some lifestyle disorders or non-communicable diseases, many factors would be simultaneously operating, like what is my genetic pool as far as hypertension is concerned, what is my lifestyle, what is my dietary pattern, what is the level of physical activity which I am regularly doing, which probably decides, am I going to develop hypertension, am I going to have ischemic heart disease, am I likely to have severe myocardial infarction in future. These are the determinants. There might be, say, physical factors like environmental temperature, ventilation. I would like to tell you that, say for example, all of we are aware that a huge crowd took place in Ahmedabad stadium to watch the cricket match. Now, we are interested in understanding what we call in epidemiology that natural experiment. Although huge crowd was there and large number of people might be shouting so that the secretions from their mouth might be going out and likely to transmit the viruses. But there were other possible protective factors. It was huge stadium. Although the social distancing may not be maintained, but the space was huge. Similarly, ventilation, more specifically air changes, excellent air changes, frequent air changes were observed there. Similarly, there might be people who were immunized either with one dose or two doses, maybe spectators. A few of them might have been asymptomatic patients there. So this is a natural kind of this is a kind of natural experiment. We study after, say, incubation period of 14 days or the longest incubation period of 3 weeks, we would like to observe whether that case of large number of people, huge crowd, has resulted into increased frequency of cases of COVID-19 in Ahmedabad or all over the state. So this shows the interaction of various factors, and a variety of factors starting from genetic factor to overt physical conditions would decide. So multifactorial disease transmission or having idea related to etiology of the diseases is an important use of epidemiology. I mentioned that majority of the diseases are multifactorial. It would not be possible to just establish a cause of a particular condition in, say, microbiological laboratory or pathological laboratory or even in biochemistry. We need to know some personal characteristics, some conducive environment, favorable environment for that condition. So, important use of epidemiology is to establish the etiology of the disease, that is the causal analysis, causative factors. We would also be able to give a number of information which would be able to establish the mode of transmission, whether the disease is airborne or is it contagious, or it transmits only through sexual intercourse, or it is purely genetic and because of the marriages or consanguinity it will take place, or some of the conditions purely occur because of the hazards of radiation. So very important use of epidemiology which I would like to insert here is establishing the etiology. Many times a single etiological factor may not be there. Risk factors would have been identified. You will learn in future classes what are the risk factors for, say, oral cancer among men in India. What are the risk factors for carcinoma of breast among urban women? All these information would be collected in epidemiology. Over a period of time, with different researches, we would be able to establish the risk. We may be able to quantify the risk using the epidemiology. That, say for example, a person like me who is working as an associate professor in medical college in community medicine, having the age of say 53 years, male sex, what is the risk for me to get COVID-19 infection even though I am vaccinated with 2 doses of vaccine? So this is what we call clinical epidemiology. This clinical epidemiology would be able to calculate the risk. Nowadays, the epidemiology, with the help of epidemiology, especially clinical epidemiology, we would be able to give a figure or a range of figure that a lady getting married at the age of 35 and getting pregnant at the age of 38, first pregnancy, what is the likelihood that, or what is the probability that she would have a baby with Down syndrome? These are very important uses of epidemiology over and above the uses which I have already mentioned. The third important concept which I would like to share, the acronym CDC and TPP. CDC is basically Center for Disease Control, situated in Atlanta city of US, which takes care of international health regulations as far as the infectious diseases are concerned. For us, CDC is count, divide and control. Whenever I have frequencies of a disease, initially I would count the disease. What is the number of cases of COVID-19 in Surat city on 23rd of March 2021? I would be able to divide it with total population of Surat city, say 40 lakhs. I would not be happy with 40 lakhs because a number of people are immune, either because of the natural infection or because of the 2 doses of vaccines. So, I am interested in knowing out of 40 or 45 lakhs of population in Surat city, how many are really at risk of developing or getting COVID-19 infection. My numerator would be number of cases reported today at 5 p.m. in Surat city. My denominator would be just 45 lakhs population, or I might try to be more accurate, getting the at-risk population. I may calculate that at-risk population is not 45 lakhs, it is only 30 lakhs. Or say I may reduce it that only 25 lakhs people in Surat city are really at risk of developing the disease. So count, then divide and then compare. I might be comparing the incidence rate of COVID-19, specifically attack rate of COVID-19 in Surat in the month of March, and I would be comparing it with attack rate in Ahmedabad city. I might be comparing it with the Madrid in Spain or London in UK, or say a small town of Texas or California, or a larger area of Washington. I might be interested in comparing the incidence of oral cancer among men with women. I am interested in knowing the rate of attempted suicide among boys and girls. All these things would give me an idea related to risk. These will also guide me in better prevention and control measures. So, I discussed three things in epidemiology. First thing, in epidemiology or in public health or in community medicine, we talk about frequency of the disease, distribution pattern, and possible determinants. Similarly, all these things require the knowledge of agent factor, host factor, and environmental factor. Environment doesn't mean only physical environment, only temperature or humidity, but there is a social environment. All of you know that the COVID-19, the more responsible environment is the social environment, the movement of the people, the behavior of the people, the regular use of mask. These are the social environment. Some cultural aspects, like the proportion of home delivery is much higher among some of the communities as compared to urban area or urban class. And third very important thing is, please remember CDC and TPP. CDC means count, divide and compare, and TPP means time, place and person. Usually the dengue hemorrhagic fever takes place in urban areas like Surat city or Delhi, New Delhi, especially during November, December and January. This is the time. Then the place, as I mentioned, chikungunya can happen in urban area. There is a season which is there for chikungunya. And the person who becomes victims of, say, skin infections. In our rural health training center area, Sachin, on an average daily 5 to 10 individuals are coming with some skin infection, usually ringworm, a fungal infection. The poor socio-economic class, the slum dwellers, the people staying in GIDC, people staying in primitive housing conditions, they are more victims of skin infection. There might be cases which are because of the allergy or occupational dermatitis. So time, place and person distribution would also give us an idea, not only the etiological factor, but also the preventive and control measures. If a person getting frequent skin infection and working in a chemical industry, occupational dermatitis. So for me as a physician or a dermatologist or even at a medical officer, over a period of time, I can suggest him that if you will not leave this job or if you will not be employed by your employer for an alternative job, you are likely to get frequent such skin infection. And it is possible that this infection might result or might terminate with even skin malignancy. So knowledge of epidemiology is very useful across all clinical branches, may it be medicine, pediatrics, gynecology, psychiatry, anesthesiology, or even physiotherapy. So basic knowledge of epidemiology is very important for any good practitioner, especially a consultant. Thank you for listening me. Now I hand over the remaining class to